You might have noticed all of us are wearing teal today. It is the first day of Ovarian Cancer Awareness Month. And according to the Colorado Ovarian Cancer Alliance, it is the deadliest kind of gynecological cancer, but can be really hard to detect. Dr. Jill Alldredge is joining us this morning. Thank you so much for joining us. I know it's early, so we appreciate it. It's so important. Can you talk about why this cancer in particular is so deadly?
Yeah, thanks so much for having me. I think there's a few things that contribute to this being one of the most deadly gynecologic cancers. For one, there is not a screening test for ovarian cancer. Pap smears do not detect ovarian cancer. And so unfortunately, that means a lot of people are late to their diagnosis. I also think that a big contributor is that the symptoms of ovarian cancer can be really subtle and oftentimes get chalked up to menopause, to irritable bowel syndrome, and they are ignored until cancer is more advanced.
Why don't we talk about that, the symptoms that you commonly see?
So an easy mnemonic to remember for the symptoms is BEAT, B-E-A-T. Women can experience bloating. They can experience eating issues like a change in appetite or being full more quickly. They can have abdominal pain, or they can have issues with their bowels or their bladder, so a change in bowel or bladder function.
Is there like a certain amount of time? Like, cause like some of this stuff can just happen, right?
Absolutely.
So, I mean, is it, okay, it's been happening for weeks at this point, or what would you suggest?
Yeah, we're all gonna have those things here and there, certainly. And so what we usually recommend is if people have had those symptoms for more than about 2 weeks, that they advocate to their doctor, whether that's their primary care doctor or their gynecologist, that they would like to be screened for ovarian cancer, which is usually done in the form of an ultrasound or a CA-125 blood test.
Okay, and is it persistent? Does it come and go, these kind of systems? What happens with it?
It can be either of those things. Oftentimes bloating can be persistent, pain can be persistent. The changes in bowel and bladder function can be come and go.
You know, I look at that list of symptoms and it's like, wow, that can overlap with a lot of different things. I mean, so how do you differentiate? I mean, what is a patient supposed to do at that point?
I really think that having awareness of symptoms and advocating to your doctor that you'd like ovarian cancer to be on their radar is the most that we can ask for patients to do.
How much of a difference does it make when you're catching a cancer like this earlier versus, unfortunately, when people are diagnosed later, at later stages?
The survival outcomes are substantially different between early stage and late stage ovarian cancer, and unfortunately we catch most of these at stage 3 or 4 because the symptoms are so subtle. So an opportunity to catch this early would be amazing. So having awareness of your body and changes from your body's norm and then advocating for yourself is the best.
I mean, it's so great because this definitely gets this on people's radars, but this is something you talk about every day of the year with patients, right?
Yeah, absolutely. I would shout this from mountaintops if I could. I think that having an awareness of one's body and knowing that these are the symptoms because they're so subtle is really helpful.
All right, well, it's great information, and hopefully, you know, if it resonates with folks, they'll pick up the phone and call their doctor and ask some questions. So
I certainly hope so, and we know that not having a screening test in ovarian cancer is infuriating. We wish that was different, and groups across the country are working on developing screening tests, and we just opened at the University of Colorado our Ovarian Cancer Innovations Group, which is sort of a think tank to work on developing screening tests to develop new treatment options for women who already have ovarian cancer. So efforts are underway.
Yeah, well, we will definitely keep close tabs on that because that is life-changing. Thank you so much for coming in today. We appreciate it.
Thank you so much.